The signs or symptoms of HIV, human immunodeficiency virus, are not always easy to notice, and many people who have HIV may not show any signs at all. If you do have symptoms, they usually appear in the first 1 to 2 months after getting infected. The symptoms in the early stage, acute stage, are different from those that happen later on, chronic stage. HIV is a virus that weakens the immune system, making it harder for the body to fight infections. While there is no cure for HIV, antiretroviral drugs have been used since the late 1980s to help control the symptoms and keep the virus in check. Once someone gets HIV, the virus stays in their body for life. This video explains some of the signs of both early and later stages of HIV and what to do if you think you've been exposed to the virus. Early symptoms and signs of HIV. You should know headaches and tiredness. HIV can lead to headaches and feeling very tired. This happens because your body's early reaction to the virus causes inflammation. You might find yourself getting tired more quickly than usual and feeling short of breath after doing simple tasks. Headaches can also be persistent and vary from mild to severe. These symptoms can also occur in the later stages of HIV. Sore muscles and joint pain. Sore muscles and joint pain are common with many viral infections. In the early stages of HIV, you might experience these aches along with other flu-like symptoms such as fever, tiredness, and headaches. Fever. In the early stage of HIV, you might get symptoms similar to the flu, such as a fever and chills. These usually show up 2 to 6 weeks after infection and might go away after a short time. If HIV is not treated, the fever and other symptoms might come back later on. When you have a fever from HIV, you'll likely have other flu-like symptoms too. This happens because your immune system is fighting the virus as it spreads through your body. R stands for acute retroviral syndrome. It's the set of symptoms that happens during the early stage of HIV when your immune system first reacts to the virus. Many people with acute HIV don't realize they have it. Swollen lymph nodes. Swollen lymph nodes are a common sign in the early stages of HIV as your body tries to fight off the virus. The lymph nodes in your armpits, neck, groin, or behind your ears may get bigger. Sometimes, this swelling is quite noticeable and can be painful or tender to the touch. Even after other early HIV symptoms go away, swollen lymph nodes can last for weeks or months for some people. Swollen lymph nodes can also happen with other infections like tuberculosis or certain cancers related to HIV. Night sweats. Night sweats can happen both in the early stage of HIV and later on if you have another infection related to HIV. Night sweats, also known as sleep hyperhidrosis, are more than just feeling sweaty at night. They can soak through your clothes and bedding and might even cause shivers. Experiencing drenching night sweats is not normal, and you should tell your doctor if this happens. Night sweats can also be caused by other things, not just HIV. For example, menopause can cause night sweats, but so can some types of cancer. Oral thrush. Oral thrush, also known as oral candidiasis, is an infection that can be an early sign of HIV. It happens when a fungus infects the inside of the mouth and throat, taking advantage of a weakened immune system. While oral thrush can occur in healthy people, it often indicates a weakened immune system in those with HIV. If the immune system is very weak, the fungus might spread to the lungs and cause pneumonia or even enter the bloodstream. Having oral thrush doesn't automatically mean you have HIV, but it's a good idea to get tested if you're at risk. As HIV progresses and weakens the immune system, it can lead to various symptoms that might be mistaken for other issues. Stomach issues. During the early stage of HIV, some people may experience stomach problems like nausea, vomiting, and diarrhea. These symptoms can also be caused by other illnesses and usually get better quickly. However, if you have ongoing nausea, vomiting, or diarrhea, it's important to drink plenty of fluids and visit your healthcare provider. Unexplained skin rash. A rash can sometimes be an early sign of HIV, although it only happens in about 40% of people who are newly infected. An HIV rash usually looks like large, flat red areas with small bumps. It can be itchy or painful and often appears with other flu-like symptoms. This rash typically starts 2 to 6 weeks after exposure to the virus and usually clears up within 1 to 2 weeks. It often affects the trunk and face but can also appear on the hands and feet. If you notice a rash with flu-like symptoms a few weeks after having sex with someone whose HIV status you don't know, you should get tested for HIV. Persistent sore throat and cough. A sore throat and dry cough can be early signs of HIV, but they can also show up in the later stages of the infection. In the later stages, these symptoms can become long-lasting and don't usually get better with common treatments like inhalers or antibiotics. They are often linked to lung infections, which are more common as HIV progresses. If you have a persistent cough, it's important to see your healthcare provider, especially if it keeps getting worse. Rapid and unexplained weight loss. In advanced stages of HIV, people may experience significant weight loss. This weight loss is more than just a few pounds. It's a sudden drop of 10% or more of your body weight, including both fat and muscle. This condition is known as HIV wasting syndrome. These days, HIV wasting is less common because antiretroviral drugs help control the virus and allow the immune system to recover. Wasting mainly occurs in people who haven't been treated for HIV. The exact reason for HIV wasting isn't fully known, but it's believed that constant inflammation from the virus speeds up energy use and lowers testosterone levels, which affects muscle building. Other reasons for severe weight loss include malnutrition, chronic diarrhea, tuberculosis, and cancer, all of which need prompt medical attention. Differences in HIV symptoms between genders. Both women and men can experience similar HIV symptoms, but women may also have additional issues like frequent yeast infections and irregular periods. Women with HIV are also at higher risk for pelvic inflammatory disease and cervical cancer. STIs and HIV risk. If you have a sexually transmitted infection, STI, there's a chance you might also have HIV. Some STIs, like syphilis and herpes, cause open sores that can make it easier for HIV to enter your body. Other STIs, like gonorrhea and chlamydia, cause inflammation in the genitals that attracts the immune cells that HIV targets. Having syphilis can increase your risk of getting HIV by up to 500%. Other STIs can also raise your risk. If you test positive for an STI, you should get tested for HIV as well. Only an HIV test can confirm if you have the virus. HIV testing and diagnosis. Everyone between the ages of 13 and 64 should get tested for HIV at least once. If you are at higher risk for HIV, you should get tested at least once a year. This includes people assigned male at birth, AMAB, who have sex with other AMAB people, those who have had anal or vaginal sex with someone who is HIV positive or whose status is unknown, individuals who share needles or syringes, those recently diagnosed with a sexually transmitted infection, STI, people who have had a new sexual partner since their last HIV test. There are several types of HIV tests, each with a different window period, the time needed after potential exposure to detect the virus. If you think you were exposed to HIV within the past 72 hours, post-exposure prophylaxis, PEP, might help prevent infection. Nucleic acid tests can usually detect HIV between 10 and 33 days after exposure. Antigen, antibody tests using blood from a vein can detect HIV after 18 to 45 days, while finger prick tests can be used 23 to 90 days after exposure. If you get a negative result, it's a good idea to confirm with a second test after the window period. If you get a positive result, it will be confirmed with a follow-up test. If the second test is also positive, you will be diagnosed with HIV. Finding out you have HIV can be challenging, but there are healthcare professionals who can provide both physical and emotional support. Your regular doctor may help or refer you to someone experienced with HIV. Managing symptoms and prevention. Starting treatment right away after an HIV diagnosis is crucial. Talk to a doctor if you notice any new or worsening symptoms. HIV can be managed with antiretroviral drugs, which should be taken throughout all stages of the disease, even if there are no visible symptoms. These drugs reduce the virus in your body by stopping it from replicating and can make the virus undetectable. This helps prevent disease progression, maintains quality of life, and stops the virus from spreading through sex. You might be prescribed a combination of drugs to prevent resistance. Most people achieve an undetectable viral load within 6 months. If this isn't possible, taking pre-exposure prophylaxis, PrEP, can protect sexual partners, and using condoms can further prevent transmission. Your doctor will monitor your HIV levels and CD4 cell counts to track your health. If HIV progresses to AIDS, additional treatments for related illnesses may be needed. Without treatment, the average survival rate after an AIDS diagnosis is about 3 years. To prevent HIV, avoid sharing needles and abstain from sex. To reduce your risk, use condoms or other barrier methods with water or silicone-based lubricants. Get tested regularly for STIs, as untreated STIs can increase your HIV risk. Consider taking PrEP if you're at high risk of HIV. Have open conversations with partners about sexual health and histories. The bottom line: HIV symptoms can vary greatly, and early detection is vital for effective management. Regular testing and timely treatment with antiretroviral drugs can help control the virus and prevent transmission. Stay informed, practice preventive measures, and seek medical advice to maintain your health and well-being. Thank you for watching. If you found this information helpful, please subscribe to our channel for more tips and updates. Wishing you good health, wealth and happiness.